It's our experience that traumatic brain injury or concussive brain injury are commonly missed in the emergency room simply because of the logistics of an emergency room. It's set up to triage injuries. It's set up to handle severe, immediate injuries that you can see: blood, vomiting, loss of consciousness, those types of things. They've got to get the worst first. You can't really see the worst first with a traumatic brain injury. You really have to sit down with the person and experience the disease of traumatic brain injury. It's not something you can really ascertain in a 90-second to 2-minute doctor visit. So when we look at traumatic brain injury, and we may have somebody who's seen their primary care physician 5 or 6 times over the course of 6 months complaining of some issues. Well, that primary care physician is really strapped, and they've maybe only sat down with that person for a total of 30 minutes, 45 minutes combined over that whole 6-month period. And when we're looking at the brain injury, we're talking to a bunch of different people. We have the luxury, the ability to have more time with the patient, with the client, to ascertain what the injuries are. And I want to be very clear, we're not diagnosing brain injuries here. That's not what we do. But what we are doing is looking for signs and symptoms of brain injuries that we've seen in our experiences with these cases. And then we're talking and educating the client's family about what needs to be done, what we think needs to be done, what we think can be helpful. It's not within the everyday common sense knowledge of a regular person. You break your arm, you know it's broken, you go to the doctor. Or you break your arm, you know it hurts, you go to the doctor, x-ray, we can see what happens. Brain injury is a totally different animal, and it needs to be handled as if it's totally different.